Hello and welcome. Today, we're going to break down something that many people experience but don't always understand: heart arrhythmias. We're going to cover what they are, when you should be concerned, and what you can do about them. Let's get right into it.
You know that feeling? Your heart suddenly does a little flip-flop or starts racing out of nowhere? It can be a little unsettling, maybe even kind of scary. Is it normal? Is something wrong? Well, today we're going to figure out what's really happening when your heart's rhythm goes a little offbeat. So, to make this super clear, here's our game plan. We'll start with the absolute basics, then get into the really crucial stuff, like when to call for help. After that, we'll look at the different types, what causes them, and then walk through how doctors diagnose and treat them. Sound good? All right, first things first. What in the world is a heart arrhythmia? Let's nail down a simple definition. Okay, think of your heart's electrical system like the wiring in your house. When everything's working just right, the lights are on, and your heart has a steady, predictable beat. But an arrhythmia is like having a faulty signal, a little short circuit that messes up that rhythm. Now, sometimes it's just a harmless flicker, but other times it can be a serious issue that needs attention right away. Now, we are moving on to what is, without a doubt, the most important part of this whole explainer. This is the stuff you absolutely need to know: how to spot a true medical emergency. So please, listen closely to this next part. This is critical. It's not just about your heart beating funny. It's about when that unusual heartbeat happens at the same time as other serious symptoms. That combination is the red flag that tells you to call for an ambulance immediately. So let's be perfectly clear. If your heart is racing or fluttering and you feel chest pain, or you get dizzy and lightheaded like you might pass out, or you're suddenly short of breath, that's an emergency. Don't second guess it. Don't wait. Pick up the phone and call your local emergency number right away. Okay, now that we have covered that life-saving information, let's take a step back. The good news is that not all irregular heartbeats are emergencies. In fact, there are a few different types, and they can range from totally harmless to pretty serious. So here's a quick breakdown. Those ectopic beats, that's the super common skipped beat feeling, and it's usually nothing to worry about. Supraventricular types start in the heart's upper chambers and can feel like a really fast fluttering pulse. Now, ventricular arrhythmias, those start in the lower chambers, and these are the ones that are considered very serious. And finally, you have bradyarrhythmia, which is just a fancy word for a slow heartbeat. We're talking under 60 beats per minute. For some people, like athletes, that can be perfectly normal. So that brings up a really good question, right? What's actually causing these electrical signals in our heart to go haywire in the first place? Well, it turns out the list of possible culprits is pretty long. It can be tied to existing heart conditions like high blood pressure, for sure, but it can also be triggered by things you might not expect, like thyroid issues or even sleep apnea. And of course, lifestyle choices play a huge part. Things like smoking, heavy drinking, and even some medicines can set it off. If you've been having some of these symptoms, the next logical step is getting to the bottom of it. So let's talk about how doctors figure this out, because the process is actually pretty straightforward and not nearly as intimidating as it might sound. The journey to a diagnosis really just starts with a conversation. You tell your doctor what's been going on. Then they'll do a physical exam and listen to your heart. From there, they'll likely order some specific tests to get a closer look at your heart's rhythm. It's a step-by-step process designed to get a clear picture of what's happening. And what are these tests? Well, an ECG is basically a quick snapshot of your heart's electrical activity at one moment in time. But since arrhythmias can be sneaky and not happen all the time, your doctor might give you a Holter monitor. Think of it as a portable ECG you wear for a day or two so it can catch any funny business. Other tests, like an echocardiogram or a stress test, can show how your heart is built and how it holds up under pressure. Okay, this brings us to the final and I think the most empowering section. What can we actually do about arrhythmias? Let's talk about both treatment and, just as importantly, prevention. Treatment is never a one-size-fits-all thing. For some people, medication is all it takes. For others, a procedure called a cardioversion, which is kind of like hitting a reset button on the heart, can fix the rhythm. There are also more advanced procedures, and sometimes implantable devices like pacemakers are needed. And hey, it's worth remembering, some of those harmless arrhythmias we talked about, they might not need any treatment at all. But here's the really great news. You have a ton of power when it comes to prevention. Honestly, one of the best things you can do for your heart is to embrace a heart-healthy lifestyle. So what does that actually look like? Well, It's all the stuff we know is good for us, right? Keeping active, eating well, quitting smoking, watching the alcohol, and keeping an eye on your blood pressure and cholesterol. Even just getting enough sleep is a big deal. These aren't just little tips, they are genuinely powerful ways to protect your long-term health. The real key here is being proactive. So if you're over 45 or over 35 for Aboriginal and Torres Strait Islander people, it's a really good idea to just ask your doctor for a regular heart health check. It's the absolute best way to stay on top of things. And that really just leaves us with one final question for you to think about. Your heart is working hard for you, 24/7. So maybe it's time to check in and make sure it's getting the care it deserves. Thanks so much for joining us.